Today, we are going to be talking about bridging the gap between innovation and operations. My name is Vanessa Moldovan, and I am the creator and the facilitator for this webinar. This is a topic that is near and dear to my heart. So I'm very glad to finally be presenting it to the world, I guess you could say. But before we get started, I always like to start with some disclaimers just so that we're all on the same page about the content that is included here today. So the first is that the information presented is for informational purposes only. Training presentations are for educational purposes and are not to replace independent professional judgment. So I'm just giving you my point of view, and then we expect that you take your professional judgment into consideration as well, or others that are around you. Statement of facts and opinions are approved and accepted as accurate information at the time of the presentation. Regulatory updates to guidelines and legislation may render this information outdated or obsolete. And all information shared is based on physician or professional billing and coding guidelines at the time of the presentation, as opposed to hospital. I want to make a really quick change here. Okay, I can't do it. Okay. Alrighty, so bridging the gap, healthcare and technology. So that's literally what we're talking about, is bringing the two together. Our operations, our innovation. How can we bridge this gap? First of all, let's talk about what is the gap, right? On one side, we have revenue cycle leaders, and on the other side, we have innovators. But there is a big gap between them. How do we know this? RCM leaders are resistant to adopting technology, and innovators are struggling to persuade those RCM leaders to adopt the technology that they've created. But the next question is, why is this gap a problem? Regardless of the resistance that is out there, revenue cycle leaders do want solutions to their problems. They just haven't heard the right messaging to convince them to adopt the technology. And the innovators, they're eager for their products to get into revenue cycles and to start making change, but they often hit roadblocks in development and marketing that leaves them stumped. So, what is it that's going to bridge that gap? Knowledge, understanding, and empathy. RCM leaders need to learn the language of innovators, and innovators need to understand the need of the revenue cycle leader. So that is exactly our goal here today. So first, we're going to share some knowledge with both sides to boost education and understanding. And then we're going to discuss how both of them can work together to drive progress and boost performance. So a little bit before we jump into some of that nitty gritty, I do want to dig a little deeper into the problems within the revenue cycle, because the problems are what create the need, and the need is what the innovators are trying to solve for, right? So what are providers struggling? Mainly, it's three main things. Like when we think about the details, like when you ask a provider or a healthcare organization, a revenue cycle leader, when you ask them, what are you struggling with? At the core are these three things. And the first is efficiency gaps, right? So we have lack of efficiency in our processes. It's slowing down reimbursement, and we need to fill those gaps, right? Then we have inconsistent accuracy. So this really goes to the data when we think of like data accuracy or entering of data into the system, or even how we're correcting claims, like they come back denied and how we're correcting them. So there just isn't consistency in that accuracy. And then finally, there's just limited effectiveness. So when we think about really being effective within the revenue cycle, when we think about being effective to verifying eligibility and benefits, effective on obtaining authorization, effective in resolving denials, all of these things, there are just so many things that get in our way, so many roadblocks, and we're limited in becoming effective. And some of the root causes of that reimbursement failure. So, because basically that's what happens, right? When the revenue cycle breaks down, we have a failure to receive reimbursement. And some of the root causes of those three things that we just talked about is human error. Then we have staffing shortages, non-standard training, disparate technology, disjointed claim tools, and payer payment burdens. So I want to talk a little bit about some of these. Human error, we talked about a little bit, right? That leads to that challenges with the accuracy that we talked about and being consistent with that accuracy. Staffing shortages, that slows down our efficiency and even our effectiveness, because we talk about that quality over quantity. We can't be effective if we don't have the quality. And the staffing shortages, we're having to work faster, we're doing more, we have more on our plate, we're stressed out. So it definitely leads to some of those main challenges. Non-standard training, those of you who know anything about me know that this is definitely something near and dear to my heart, is standardized training. And it is difficult in this particular industry to have standardized training throughout the revenue cycle. So we know that there's certified medical coding, you can become a certified biller, but it still leaves us with gaps because it isn't as standardized as, let's say, becoming a physician, right? Pretty much the curriculum for becoming a physician is pretty standardized, right? We just don't have that, and that leaves gaps and leads to these errors and such we were talking about. Then disparate technology, what I mean by that is you talk to somebody, or if you work in an organization yourself and you have, one company that's hosting your EMR, another one hosting your practice management system, then you might have another one for managing your medication, another one for doing your prior authorizations. There's just all of this technology. And then that kind of leads into disjointed claims tools. And what we mean by that is, like, when you're working, especially if we think about preparing a clean claim or following up on a denial, we have all of these different places that we're going to, referring to, all these different resources, and they're all in different places, right? We go one place for our payment policies, we go to another place for our coding guidelines. It's just all over the place. There isn't just one source of truth that we can refer to. And then finally, we have payer payment burdens. And what I mean by that is that there are burdens related to the reimbursement guidelines that we have. In order to get reimbursement from a payer, we have to follow the payer's rules. And some of those rules are not so easy to follow. Like, they cause administrative burdens for us, or they're not automated, they're very manual, all kinds of things. So it just leads to, again, that inefficiency, the lack of accuracy, and the lack of effectiveness that we were talking about. So this is really important to understand these root causes. And there's a couple of reasons that I wanted to talk about this before we jump into the next section, is because there may be some people listening here that you really aren't fully aware of what is causing the challenges that you're experiencing. And then you may not even be aware of some of those challenges. Like, you might be a leader in your organization and you have people who report to you, and they come to you and they're like, we're struggling with eligibility benefit verification. And you're sitting there and you're wondering, like, how can you be struggling with that? Like, why is this an issue? And there's just a lot that goes together to getting revenue cycle right, to getting reimbursement right. And so I just want everyone who's listening, so whether we have our tech teams and our innovators, or whether we have our revenue cycle leaders, everyone needs to really be aware of those challenges that we're facing so we can work together in resolving them. And that leads us to learning about revenue cycle, right? So we're going to do a little bit of revenue cycle 101 and talk about how money moves in healthcare. So first of all, we have, what is revenue cycle to begin with? So the revenue cycle consists of every step from the moment a patient books an appointment until the final payment is collected. It's from scheduling to collecting that final payment. And really, if we think about it also, the provider performs a service, we are trying to get reimbursement for that service. Just like somebody who works at Starbucks, they work for 8 hours, they want to get paid for 8 hours, right? This is the same thing, but it is not that straightforward for a provider of service to get paid for those services. But that's what the revenue cycle is. It's all of those steps. And so we're going to talk about the revenue cycle components. So here we're going to have a visual, right, of the full revenue cycle and the components within it. And I just want to say, before we jump into this, that you can Google revenue cycle components, revenue cycle function, all the parts of the revenue cycle, and you'll come up with variations. Some will have 6 steps, some will have 15 steps. They all have different steps. But This is how I typically visualize it. For me, this is how I teach it. And they're the functions within the revenue cycle at high level that I believe are the most important. And then also when we think about solving for challenges within them, these are, in my opinion, how best to categorize them. So first and foremost, which many people don't talk about credentialing and enrollment when they talk about the revenue cycle components or the functions. But I always start out with credentialing and enrollment because nobody's getting paid if credentialing isn't completed and it isn't completed correctly. If the providers aren't enrolled with the payers, then they're not going to get reimbursed correctly. If credentialing isn't completed for the payer, for the provider, and for the facility, that they're performing the services, again, no one is getting paid if that's not happening correctly. So that's why I feel like it should be first and foremost, because there's no sense in talking about anything else if that hasn't been done. Then next we have the appointment. Then we have registration. And some people put appointment and registration together, and that's totally fine. It really is. I said, what is really important is that when we're having these conversations, that we're talking about all of the important steps within these functions are occurring, right? But I separate them because there's so many things that happen during an appointment while if you're on the phone with a patient and you're getting their information for an appointment, or they're making their appointment through an app or through a portal, it doesn't matter. That there's so much information that must be collected in order to ensure that we close the gap and collect revenue for the service rendered. So then we have our registration, eligibility and benefit verification, prior authorization, coding, charge creation, claims review and submission, payment posting, and then finally we have our insurance and patient AR. So those are our revenue cycle components. Okay, so next we're going to talk about revenue cycle management. So this is something we hear this all the time, right? RCM this, RCM that, right? We have revenue cycle managers, we have revenue cycle management systems, software. There's revenue cycle management just everywhere. But it is defined as the strategies and operations that ensure accurate, timely reimbursement. So how I like to think of it as what is our primary objective in managing the revenue cycle? It is preventing revenue leakage while maximizing collections. So we're always asking ourselves, if we think of a manager of revenue cycle, right? Where can I prevent revenue leakage? Every single step of the revenue cycle. Where can I prevent that leakage? And how can I collect that revenue as quickly as possible and as few steps as possible, which is that part of maximizing collections. And again, this is what makes revenue cycle management so complex is, as we saw in that last slide, there's a lot of steps in there to keep track of. And within those steps, there's a lot of functions, a lot of moving parts, rules we have to follow, guidelines, policies. But overall, this is our primary objective, is we're preventing that revenue leakage while maximizing collections. So if you're listening to this and you are on the innovation side, you're on the tech side, and you're like, what are we building? Why are we building this product or this solution? Why does it exist? This is why it exists. And top of mind to your customer, this is exactly why they care about it. Because what you're building is going to help them prevent revenue leakage while maximizing collections. So if you take nothing else with you, remember that is ultimately the purpose of what you're creating. And you don't want to create more revenue leakage for that. They implement your solution and it ends up causing more problems. You want to tie things up, prevent that leakage, maximize those collections. Okay, so the revenue cycle can be divided up into 3 parts. And I wanted to put this in here because this is common terminology when we refer to the revenue cycle, and I'm going to be referring to it a few times in this webinar. So I just want to put this out here. We have the front end. So front end could also be referred to as pre-service. So it's all the revenue cycle functions that are occurring pre-service. So that's your appointment scheduling, patient registration, eligibility and benefit verification, and prior authorizations as they're needed. Because prior authorizations, there are some specialties that have very few or have no prior authorizations. And then there are some where they do have to check for them, but not every single service is going to need a prior authorization. So that would be considered the front end of the revenue cycle. Then we have mid-cycle, which mid-cycle would then be the provider encounter, which what that means is like the actual visit, right? So the patient goes in, sees the provider, and there are functions that take place within that visit that are really important to the outcome of the reimbursement of that service. So then we have the documentation that needs to be completed by the provider so that then we can have the coding aspect of that too. So that all falls into your mid-cycle. And then your back end is going to be your claim creation and review, claim submission, payment posting and reconciliation, denial management, and AR. If you are doing some type of charge entry or charge of some sort, that typically goes into your mid-cycle. And it can sometimes be like you have coding and then they also enter the charges. And so that would be mid-cycle because the charge entry is before the claim is created. But so many organizations do have it. It's automatic. And in your claim creation, your charges are actually being created. So that's why I don't really have it separate here because coding creates those charges, claim creation creates a charges. So that's why I didn't really specify it here. But so that was intentional. But if it is being done separately from claim creation, it would be considered mid-cycle. So there's kind of your three parts of your revenue cycle, your front end, your mid-cycle, and your back end. And there are sometimes you'll see technology is even marketed that way. Like they solve for front end challenges or front end errors. Or our solution focuses on the back end. They might say something like that. So it's a very common term in the industry. Okay, so another concept that's really important to understand as you are working with technology, looking at a vendor, and is your cost to collect and your KPIs. And the reason why this is important is if you're going out there and you're going shopping and you want to improve something, you have to know where you're at in order to know how much you need to improve. And some ways to know where you're at is cost to collect and KPIs. It's also helpful when you implement something. So let's say you decide to implement a piece of technology to help improve your payment posting. If you don't really have a KPI or a benchmark or something to follow, then you don't really know if that technology is effective or not. So having KPIs is really important in this process, but in general, they are good for monitoring, improving your metrics so you can optimize your revenue performance. It really is essential. But cost to collect, how it's defined is collection expense per dollar of cash collected. And this is really important to know because overall, as you're improving your accuracy, your efficiency, and your effectiveness, you're reducing that cost to collect, right? So all of the expenses that go into from beginning to end, as we talked about the revenue cycle. So every single expense, when we talk about the people, the technology, the subscriptions, the paper, all of that for every single dollar that you collect, of course, you want to reduce that as much as possible because that, of course, is your profit. Okay. So that's your cost to collect, an important KPI to be aware of. But then other key performance indicators that are really important within the revenue cycle for monitoring and ensuring optimal revenue performance is number one, you have your days in AR. So these are this industry standard. Your target should be less than 40 days for your days in AR. Now, I just want to put this out here that all of these statistics here are from the MGMA, and they release on an annual basis. They release benchmarks and KPIs and stuff for all across the industry, and they will get very detailed and granular, but then they also have general statistics. So these are general, but there could be different KPIs for you if you are orthopedic in the East Coast of a practice with 20 providers. That could be a different days in AR than just general days in AR. So if you really are interested in getting much more accurate industry standards for your organization, I would recommend you work with the MGMA on that. Anyway, so days in AR, so industry target should be less than 40 days. So the days in AR is a key indicator of how quickly your organization is getting paid, right? So it's the average days for one claim or one service to be reimbursed, right? So if you're looking at, let's say you're at 42 days, then that means that's the average time it takes from the time of service that the service is rendered until the balance is zero on that service date. You're averaging within your organization 42 days. So that's what that means. Then you have your clean claim rate, and you want to aim for about 98% or higher. The clean claim rate measures the percentage of claims submitted without errors that are accepted by the payer the first time, accepted and processed. And there's a whole industry definition of a clean claim. Literally, like Medicare has a definition, some payers have their definitions. The most common and accepted one in the industry is that the claim is processed by the insurance, fully adjudicated by the insurance company with no request for additional information. No intervention is needed at all. And so the aim is for 90%, 98% or higher. But I'm just going to put it out there that if you see a clean claim rate that's being reported, like maybe by your clearinghouse or your practice management system, really it's important to ask them how they're calculating that clean claim rate. Because there are some denials that are out of your control. Some of them are totally within your control, but there are some that aren't. So sometimes those are removed to give a different clean claim rate. But basically, we always want to prevent denials. We want those claims to get adjudicated as fast as possible. So that is a goal of creating a clean claim. And then finally, we have a denial rate. This is another really important KPI to keep your denial rates below 5%. So it measures the percentage of claims that are denied. So it's your claims that are denied divided by your total claims that are submitted, and that gives you your denial rate. And you want to keep that below 5%. And there are other KPIs that are important. You may have KPIs that you're tracking within your organization, totally fine. There's aging, the days aging within your AR, those kinds of things. There's all kinds of KPIs. But the point here is that first, it's really important to have those performance indicators so that you just know how you're doing and how you can get better. And also it gives you like I said, if you implement something to help improve, you need to have something to give you that standard on if you're improving. And cost to collect is just so important to have, especially nowadays. Okay, so let's get into the conversation of technology, right? Because we're talking here, we've got our revenue cycle, right? We got our operations, and then we have our innovators, we have our technology. And it really is the time right now that we're in. It really is not if you're going to implement technology, it's more of when are you going to implement technology? And we talked about at the beginning of those pain points, right? The staffing shortages, the lack of standardization in education. We talked about that. And technology can fill in those gaps. And especially for 5 years now, so many of us have been struggling with the staffing shortages. And then not only that, but the staff that we do have just doesn't have the level of education and expertise that we used to consider just normal. A lot of those individuals have left the industry. And it's wonderful to have new people who are up and coming and they're so eager to learn, but it does lead to some of those inaccuracies, efficiency, and effectiveness. And we just don't have room for it. The margins are tighter than ever. So there really is need. So let's talk about some of that need for tech. What is its role? Why do we need it? So first of all, these are some examples of where tech is used within the revenue cycle, right? And its role. So we have some tech that's our systems that we're using, which would be our EMR, our practice management system, or your billing system, a clearinghouse you could be using. There's all kinds of systems, tools that we have to run our revenue cycles. So we have our claim scrubbers, denial dashboards, claim status. Then we also have some that give us insights into our revenue cycle and how we're doing. So technology that helps with reporting, helps with creating those KPIs for us. Maybe you have a reporting dashboard or KPI dashboard, tracking payments, reconciliation. There's so much technology that can streamline revenue cycle processes. And we have eligibility, benefit verification, all kinds. But it is key to optimizing the revenue cycle. Automation can handle so many tasks. And again, reducing those chances of human error, improving the effectiveness, improving efficiency, and helping to prevent that revenue leakage. But an important thing that I just want to put in here is that technology is not intended to remove or replace humans. It is there definitely is some scenarios where an organization might be fully overstaffed, and you may have been a part of a downsizing because technology was implemented. But actually, how I like to think about it, and I hope that the leaders and the decision makers out there will take this into consideration, is that I worked in revenue cycle for decades and in different types of revenue cycles, in different environments, in different specialties, different sizes, access to all kinds of different technology, lots of it, very little of it. But I can tell you something that is common among all the revenue cycles I've been a part of, or I've helped consult or manage, is that there is always something to be done. There is always room for improvement. And there is always going to be the need for humans to be adding that compliance, to be adding the auditing, to be adding the sophistication and the level of complex reasoning that is needed for some of the things that we handle, some of the denials that we receive, some of the review of medical records. And then there are just other processes holding all of this together. The little things in between that kind of are the glue to all of these processes that oftentimes get put to the side and nobody has time for. And by freeing up your current staff who is performing services that are maybe just administrative or they're just mundane, they're really repetitive, by freeing up your teams from doing those, they can come over and work on some of these more complex or even tasks that just you haven't been able to get to. And if you were able to get to it, it really would improve your organization. So that's how I like to think of it. I think that many of us are not being utilized to our full potential. And by implementing technology, take away some of that stuff that's just that easy, everyday mundane stuff, we can get to some of that's more complex. Technology's role is also to minimize that burden and those human errors, reduce the staff's workload, and increase efficiency. Okay, let's talk about some reconciliation points and common leakage. And again, this is really important information for both our revenue cycle leaders and for our innovators that are out there to just let's be aware of the challenges that are around us, but also some of those more common ones. And I would say these are some that you can just assume that an organization is struggling with these, one or all. So these are where the gaps occur, right? And we're really focused to recover lost revenue. So when we talk about claim quality, that's where our clean claim conversation comes into play. Creating that claim just as clean as possible, which means we are following every payer guideline and requirement for reimbursement. We're following coding and billing guidelines, and we're following the NUCC claim requirements for a claim. So just getting that claim as squeaky clean so that it processes the first time. Denials. In some organizations, like I said, some organizations are going to struggle with all of these, but they may struggle with some of them, one of them, all three of them. But denials are typically a pain point for organizations. They have too many of them. They can't get to all of them. They don't have enough team members to resolve them or to review them. So they're writing off denials. They're having a challenge preventing them so that they can reduce them, and even just figuring out how to work them. Getting someone on staff who understands maybe some of those more complex denials, finding someone who has that level of expertise to help with reversing those denials. And then finally, your front end intake. When we talk about like statistics in the industry, across the industry, 50% of denials are a result of what's happening before the service is even being rendered, which, as we talked about, is our front end revenue cycle, right? So during that front end, which is our appointment, registration, eligibility and benefit verification, and prior authorizations, these are where so many errors are taking place. And again, slowing down that revenue, or we have revenue leakage. So these are those where to really focus to recover that lost revenue, where there are gaps and where we can fill in those gaps with some technology. So we're going to dive in a little bit into some of those three. We're going to dive in a little bit more and talk about it. So front end accuracy drives revenue integrity. What I mean by revenue integrity, many of you may have already, you've heard this term before. Sometimes it's referred to as payment integrity. And it was a term for many years, I would even say decades. It was something that was done over on the hospital side. So when those of us who work on the physician side, we didn't really hear this term revenue integrity. But basically what it means is that on the physician side is that we're creating clean claims, but we're also to make sure that claim is clean, right? When it goes to the insurance company, but also when we receive it back, that the reimbursement that has been received is in alignment with the contract reimbursement. Like I said in the beginning, right? We have the credentialing, we have enrollment, contracting is also done in the beginning of a practice. And at that time, the payer and the provider are coming to an agreement of what the reimbursement is going to be for services. And so part of revenue integrity or payment integrity is making sure that the reimbursement received or how the claim was adjudicated aligns with those contract agreements. And that's just really important. And it's becoming more and more prevalent, reviewing the payments that are received to make sure that the organization isn't being underpaid or inaccurately paid, but then also at the front end before the claim is going out. And so to ensure that we have just the cleanest claims and try to prevent any of that, we just want to prevent it as much as possible. That intake sets that foundation for clean claims. Errors that are made at the front end, they trigger those downstream denials. Like I said, 50% of the denials in the industry are part of this front end processes. So some of those risk areas are incomplete demographics. So we have incorrect dates of birth, missing names are incorrectly inputted, or their parts of it are missing, or the relationship to the subscriber is incorrect. Unverified insurance. So we're putting insurance into the system that hasn't been verified whether the patient is eligible, whether they have benefits for the services that are being rendered. All of that these are high risk areas. And then finally, missing or inaccurate authorizations. Many organizations who prior authorization is a part of their reimbursement from payers, the reimbursement requirement, really struggle with keeping up with all of those requirements, keeping up with the guidelines, keeping up with is an authorization even required for the service being rendered. So it's really easy to miss it or to have inaccurate authorization information. And no blaming going on here. This is a judgment-free zone. It is super, super difficult to get all of this correct. And again, to create those clean claims, this is not easy. And it's certainly for humans who typically in these roles are doing a lot of things all at once, right? They're multitasking. And to reduce those errors, it's challenging. And clean claims, this is our first line of defense to denials. And so clean claims are payable on the first submission. We want to reduce delays. We want to reduce rework. We want to reduce denials. That's your whole purpose behind clean claims. And it requires accurate credentialing, front-end intake, charge capture, coding. All of that needs to be accurate in order for that clean claim to be created. And then finally, some common gaps in creating a clean claim. First and foremost, in my experience, is ignoring edits. And what I mean by this is many organizations have some type of what we might refer to as a claim scrubber, right? Or they might have custom edits that have been created to review the claim and see if there are any errors on the claim, right? And then it puts it into an error status, and then somebody goes in and fixes it, and then they send that claim out. There are some edits that when they're created, they're given the option of being like an optional fix. And so the user has the opportunity to bypass that edit. And that could be a whole webinar on its own of what those are, why they would bypass it. But by ignoring edits, either ignoring creating them, ignoring, fixing the correction. What was it? Fixing the error so that you have a clean claim. This is going to create a denial potentially because you're not taking that direction from the edit that came up. So that's what that means. And I see it all too often. And then the person who is down working denials or the AR has to deal with the error that could have been fixed before the claim went out. Another very common gap in creating clean claims is missing modifiers. And modifiers are, especially in this world of physician billing, they're a big deal. They play a big part in our billing and in our coding and a big part in reimbursement guidelines. But they're not so easy to understand. And there are rules around them and there's edits set up by payers around them. It's not easy to manage them. And just making sure that they are on the claim correctly, that they're not missing, but also that they are correct to begin with is really important. And then finally, another just really common gap with, again, creating those clean claims is closing encounters past timely filing. That's what the PTF stands for. So what I mean by this is a clean claim, right, is a claim that is processed, that's adjudicated by the payer successfully, right? So we're preventing a denial. Timely filing is a denial. It's a timely filing is a requirement from the payer for reimbursement. So claims have to be submitted to the payer within a specific time frame from the service date. If it isn't submitted to the payer within that time frame, you will receive a denial for timely filing, and there is no reversing that denial if it truly was submitted past timely filing. What can happen is that the encounters that the providers are working, so the encounter is open until the provider closes it. And that's typically done after they finish their documentation. They sign off on the encounter and the encounter is considered closed. Once that encounter is closed, then you can bill the claim. You can't bill the claim until the encounter is closed. It's non-compliant to do so. If the providers are waiting too long to close those encounters, that is missed revenue, and that's creating denials. So even though the claim itself may go out the door and may have the right modifier on it, it may have the right diagnosis code, like all the registration is correct, it could get denied for timely filing if that encounter isn't being closed. Okay, and then finally we have denials. The denials are big culprits for slowing down our revenue. So you can sum it up as downstream symptoms of upstream failures, right? Denials are a key signal of breakdowns across the revenue cycle. What I like to say is the denials, they're the good, the bad, and the ugly within an organization. And you learn to love and hate them at the same time. Any of you who know me or have heard me speak before or gone to some of my workshops, that denials are something that I feel very strongly about, that they should be a center conversation within the organization. And denial resolution, it's so important to know how to appropriately resolve a denial. But then also, it's really important to understand your denials, to take a look at them. And this is called denial management. You're managing your denials. How many denials do we have? What are our top denials? You're taking a look at them and seeing what are the root causes for those denials. How can we prevent those denials? That's the kind of that love and hate relationship with denials is we hate getting them because they take a lot of work to resolve. Sometimes you can't get them resolved. They slow down reimbursement, all of that. But they also show us where we have areas of opportunity within our organization. They show us, if we take a look at this and we look at the root cause, we have an opportunity to improve it and to reduce those denials, which I think is really one of the advantages of the revenue cycle. One of the things I love about revenue cycle is there's so much evidence within the revenue cycle. When we take a look at it, when we study it and really try to understand it, looking at how one thing leads to the next, these downstream symptoms of upstream failures, we can solve so many things and make so many improvements. But your denials cause significant financial and operational impact for obvious reasons. Financially, it just slows down reimbursement. And then for some denials, like if you're not addressing what's causing those denials, they're just going to continue happening and you're not going to be able to reverse them. And that is lost money. Operational impact, it's like I mentioned before, it's tough to find people who are really good at denial resolution. and are effective at it and very efficient at it. So that can affect your operations. Most denials in the industry, I mentioned this a little bit before, but most style denials stem from eligibility, prior authorizations, and documentation requests. So again, when we look at the industry, 50% are coming from like eligibility. And what we mean by that really is that in the organization, you may be checking eligibility. You may have an eligibility and benefit verification software. You may have automation through the roof related to eligibility and benefits. But if nobody is following up on that and making the appropriate changes, or they're making the changes and they're making a mistake as they make the changes, that's going to cause denials. And that's what we really find in the industry. We find that many organizations do have some type of a software or technology tool to help with eligibility and benefit verification, but there's always that second step. The EBV just gives you results. If the EBV by itself does not make the appropriate change in the system or on the claim that's necessary to ensure payment. So it's really important. So that's why we're still experiencing those. Some of you listening may be thinking, it's 2025. Why are we still getting eligibility denials when we've had EDI forever? And that's why. And then prior authorizations, we've talked a lot about that. Even if you are following all the processes and all the policies put forth by the payer for your prior authorizations, you can still get denials for various reasons. And they're up there with eligibility denials. And then finally, documentation requests. We've just been finding that the feedback that we get back from the industry when we go out and we ask people who are living through this every single day, that the documentation requests are increasing more and more, and it's quite a burden. Documentation requests take a lot of work to pull the documentation, to put it with an appeal, submit it through the payer portal, whatever it is. That's quite a lot of work, and it adds time to each one of those denials. Okay, so let's get to some fun stuff, right? Where can tech help? We talked about these challenges that are within the revenue cycle, right? They're all over the place. And I hope that this conversation that we've had really gives you an idea, especially if you're somebody who maybe because of your role within the organization, you really weren't aware that there were so many challenges all throughout the revenue cycle. So I hope that has really helped with some enlightenment. And then also those of you who are involved in technology or who want to create some type of a solution to help revenue cycle, I hope that really gave a good picture of where you can jump in and help with some solutions. But let's talk a little bit about where tech can help, because some of us, frankly, we're not aware of where it can help. First is, and I'm not going to be able to cover every single possible thing that where technology can come in and assist, because there are so many. But I'm just going to talk kind of high level here and put some ideas out there. So first of all, we have in the setup process, right? So we have contract management, we have credentialing. And we all know there are challenges with these. There's a lot of manual processes. There's a lot of tracking that has to be done with credentialing, especially. You send out the form, you send out all of the paperwork and everything, and then you have to track it to make sure that you don't miss deadlines. So there's just a lot of administrative work around that. And then you have your contract management. So, most providers are contracted with a payer, so they have a contract. In that contract is full of wonderful information that is so useful for prior authorizations, for resolving denials, for underpayments, just a lot of very valuable information is in there. And many of us don't have access to it. I'm telling you, in the 20 years that I was in operations, revenue cycle operations, I never saw a contract in the entire 20 years I was in operations. And that information could have really been useful to me. But then also to the entire organization. Dive into your contracts, get that information out of there, and start identifying underpayments, right? Start giving the contract guidelines to your AR team to help them with escalating of denials. But it takes technology to be able to manage that and to be able to dive into them. Because if not, you're going through pages and pages and pages and pages of a contract with a bunch of legalese and everything in it. Technology can certainly ease that burden. Okay, so then we have our front end. Where can tech help? Eligibility, prior authorization, and patient estimation. We've heard these before. This is, especially the eligibility, this is not new. But where we now have technology can help us with that second part of that eligibility and benefit verification I was talking about. There is technology out there that will take the responses back from the payer, right? The updated ID number, or maybe there's even an updated address or network status, and take that information and input it into the practice management system and automatically update that information. So certainly there's technology out there that can assist with that. And then our prior authorization. So this has been a thing for several years is there technology out there that can help us with end-to-end prior authorization? And there is definitely tech that can help with this. And again, end-to-end, and can give you the results and the outcome that you're looking for, and can do it with just low overhead and quick implementation. It is out there. It is definitely out there. And then finally, we have patient estimation. This is really another one that I'm just so thrilled that there finally is great tech out there for organizations. Because as we all know, the No Surprises Act came out 5 years ago now, I think, which requires the good faith estimate. So for many years, many organizations have been looking for a good patient estimation tool. And what I mean by good is that it's accurate, right? It gives that accurate estimation within a couple $100 with a very small margin. And now we can definitely have that, especially with agentic AI and AI that's out there. We can get these great estimations by pulling in the information from your contract so that you know what your contract reimbursement is, pulling in that network status from the eligibility response, bringing all of this information together to get a truly accurate patient estimation. So just love it that there's tech out there to help with that. Then we have our mid-cycle. So we have coding support, claim scrubbing, and then we have our back-end payment posting, denial detection, and analytics. So just a little bit about these before moving on. Coding support, again, it's been around for a while, but now that we have better technology, again, we can go to that next step where, yes, we've been able to review a medical record, extract the information that's needed to assign the correct code to it. But now we can go above and beyond, and we can create those claims. We can do some compliance review. We can do some auditing, and then claim scrubbing. We can have so many sources of truth brought together. So you can review a claim against a payer policy, right? So all of those clinical billing policies, when you're scrubbing the claim, it does the claim and how it's coded and the payer that it's going to, does it follow that payer policy? Now, again, it's like technology 2.0, right? We've had scrubbing's been around since I've been in the industry, but now we have it to the next level to really create those claims and to reduce that workload and that burden on our staff. Payment posting, detecting of denials, and analytics. Again, taking these things that have been, lots of automation has been applied to them over the last couple of decades, but now we're just taking that to the next level and reducing administrative burden that's around many of the challenges that are around payment posting and denial detection analytics. So I hope that this kind of, especially for those of you who are thinking about implementing technology, maybe you've already had a conversation with a vendor that, sometimes, and I know how this is because I've done it myself, right? You're sitting in front of this vendor. They're asking you, how can we help you? What are the challenges that you're having within your organization? And you're sitting there and you're thinking, there is no way that you can help me. That's too complex. The administrative burden's too much. The payer's requirements are too much, because we have lived with this complexity and this burden for so long. But now I hope that some of this conversation will open up those ideas a little bit more, and that you'll be able to think of some of these ideas, really spark some ideas in your head of, you know what? We didn't know that you could extract information from a contract and use that to identify underpayments. Or we didn't know there was eligibility and benefit verification that could then update the patient chart. Guess what? There's a lot within your organization, in particular, your processes that are specific to you, special to you, that now technology can be so customized. So I really hope you got the juices flowing and in thinking about where it can be solved. All right. Really quickly, I want to discuss a few more things before we close for the evening. And then, of course, I want to open it up for some questions if you have any questions. But now I want to talk about, we talked about that there's this gap that we need to close, right? So we have the tech innovator, we have the RCM leader, and now we're at the point where we're having this conversation. Okay. And typically the conversation is happening at a demo of some sort, or maybe you're having your first call with them in that discovery call where you're meeting for the first time. They're asking you what your challenges are. And so I want there to be success in this conversation. And just to give you a little bit of background, like I have had the privilege over the last 4 years to witness many sales conversations from the perspective of the RCM leader and from the perspective of the tech innovator. And this is really where the idea of this webinar came from, because I saw there was just so much opportunity to make this easier on both sides, right? Like I said, the gap is that we have this revenue cycle leader who needs to solve for these challenges. And they know that it's time for tech. Like we've just got to look at tech. We cannot continue to be doing these things manually. And they're getting ready to go into this conversation. And yet they're thinking, I don't know what they're talking about. For me, it's every time I go to get my car fixed, like I know nothing about cars. They could tell me that I need a spaceship attached to my car to be like, okay, if that's what you think. It's just, I know nothing about it. I know that feeling of going into those conversations. I don't know how to make the best choice. I don't know the questions to ask. I just know that I have this problem. And then oftentimes what's happening too is that we feel like we speak a different language than they do, right? So we're telling them like, this is my challenge, this is my challenge. And then they look at us with deer in the headlights. I have no idea what you're talking about. And so they try to give us these solutions and we just sit there, no, that is not going to fix it because you don't really understand it. So there's your revenue cycle leader. And then on the other side, you have your innovator who doesn't speak the language of their customer, right? They have such a desire to solve for these problems that they hear about, right? That people tell them about, that they read about. They know there are challenges in this industry, but maybe they're like starting to realize, wow, this is really complex. Like this is something that it takes so many years to really understand, but I really want to solve for this. And how do I get that message across that I have this great product and this great solution for this other person? So this is the conversation that I'm talking about and that I've had the privilege of being witness to so many of them. And this is from my perspective on advice to improve that conversation because I really want solutions for my people, my revenue cycle leaders out there, the healthcare industry. I really want these pain points resolved for them. And I really want the tech innovators to have what they need to be successful in order to get those solutions over to the rev cycle leaders. Okay, so let's jump in really quick and talk about this. First of all, I want to talk about just getting ready for this conversation, right? You're prepping yourself to have this conversation, a sales call, demo, or whatever. And just a few things that I want to put out there is understanding the SaaS innovators and their perspective. So SaaS stands for software as a service. So just taking a minute to think about where they're coming from, respecting their expertise. And I've just seen it too many times where it's like me, if I were to go to get my car fixed and stand there and try to talk to that person, like I know what they're talking about and I know a car like they know a car. The fact is that it's probably very low possibility and it's a low statistic that the RCM leader is also a innovator and a tech developer. Some of them are, and they know a lot about it, but most of the time we're not. So really important to respect, they have an area of expertise. You have an area of expertise, but they also have an area of expertise. And it's important to respect that. Acknowledge their innovation. I don't know, I'm just a promoter of this. Even if you get through the entire presentation, their entire demo, and you're like, this is not really for us, or you've identified where maybe it's not built the best, or maybe it just has gaps in it that aren't going to be good for you. I think it's important to just acknowledge their innovation. There's a lot that goes into building this technology. They had a dream. They had a goal that was set forth to them. They put the work into it and created this thing. And I think that it's worth acknowledging. Provide constructive feedback. Be very clear, actionable, and kind when you're suggesting improvements. My experience has been that most of the time when I'm in a demo or I'm listening to the technology, they are very open to feedback. They're like, thank you so much for telling me that that particular functionality is not really helpful and it would be more helpful if it did this thing. Most of the time, who you're talking to has direct access to the engineer. Sometimes you're even talking to the engineer themselves. And if what you're suggesting to them, because guess what? You're the user, you're the customer. And if you're suggesting an improvement to them that could really help them with reaching their goals as well, go for it. But be constructive and be kind, be clear about it, but definitely tell them. Tech changes take time. So just keep in mind the innovation cycles don't allow for immediate fixes. So whether you're already signed up, you're already implemented, you're asking them to make changes, or if you're saying like, hey, if you make this particular change, we will definitely sign on the dotted line. Just keep in mind that sometimes it takes time for that. So it might be like, you know what? We can definitely do that. We're putting it on our product map. It's not going to be completed until this time. So maybe you would be open to, okay, we're going to move forward, but in the contract, it is specified that you are going to make those changes. Their focus is product and functionality. Revenue cycle operations are not their core expertise. So just really keep that in mind. They're product people. They're thinking about the functionality of that product. They're not going to know your core expertise. So just understand that perspective. Different motivations exist. So some are purely sales driven, while others genuinely want to solve industry problems. I think that it's important to identify where that motivation exists with the person that you're talking to. And sometimes you're going to identify it right away. Like they're really not there to solve your problem. They're just there to sell you something. And in my experience, and again, we'll talk about this a little bit later, but be an advocate for yourself and say, hey, can I get a different salesperson? Or can I talk to somebody who can really dive into some of these questions with me and is really going to listen to what I'm saying? Be an advocate for yourself. But it is true that sometimes, let's be real, sometimes they're just really focused on making the sale. But there are genuinely those out there to want to solve the industry problem, and that's why they're there. And then just remember, no solution is perfect. Every product has limitations. So focus on how it can be optimized rather than just dismissing it. We all know this. We've been working with practice management systems for decades, and we know there is not a perfect practice management system out there. And you know why? Because we all have different expectations. We all have different operations. We all have specifications to how we run our processes. So there isn't going to be one thing it's one size fits all, right? So just keep that open-minded and think of optimization to your organization. Okay, so next we have for the innovators, right? So they're going into this conversation, right? How can they prepare for a conversation? So we want to apply revenue cycle insights to SaaS product development and messaging. So again, just like with the revenue cycle leader, respect their expertise. Your expertise as an innovator is technology, theirs is in revenue cycle management. Highly unlikely their expertise is not going to be technology. Also, if your focus is sales, their expertise is not going to be sales. Their expertise is not going to be discovery and problem statements and, all of that, right? Their expertise is revenue cycle management. They're just coming to you with a problem and, respect that expertise. And they are definitely going to know more than you are going to know. So being very respectful of that. Acknowledge revenue cycle complexity. It is intricate and it is constantly evolving. And I'm hoping you made it this far. You've heard the first part of this webinar, and I'm hoping that's opening your eyes to the fact that there is so much involved in revenue cycle. I've been doing this for almost 3 decades. I learn something all the time about it as well. And I'll tell you, anybody that I know who works in revenue cycle, they're going to tell you the same thing. It's constantly changing, constantly evolving. We're always learning. And so it is so important to acknowledge that as the innovator, as the person representing the innovation organization, that it is not simple. And so that's why there's so many of these situations where you may be solving for one thing, but there's so many other things that person is thinking about. Okay, so recognize compliance pressures. So payer rules and regulations are non-negotiable and they're ever changing. So compliance is top of mind for us revenue cycle leaders. So we're going to dig into that. When we're seeing these demos, we're being introduced to these solutions. We're going to dig into, are you going to be able to help us to stay compliant? There's like actual federal laws that we have to follow within revenue cycle to keep people out of prison. So very important to recognize that. Integrate with workflows and operations. Understand the daily challenges and constraints of revenue cycle teams. So just understand that even though you may have been directed by your product team, or that this particular product that has been built is going to integrate with everything, it's going to work with all the workflows, it's going to go inside their operation seamlessly. It's because of these complexities, because of these specializations of different revenue cycles throughout the industry, it is not always going to integrate. It is not always going to work with their workflows and to respect that. There are just challenges and constraints with that. So just be aware of that. Appreciate revenue pressures. RCM leaders must collect revenue while meeting strict performance metrics. So they're thinking about disruption. How is this going to disrupt my revenue flow? How long is it going to take to implement it? What's going to be down while you're implementing it? On the go live date, how long is it going to disrupt my cash flow? Am I going to have to pull people internally to work on this implementation, to work on this build? And that's disruptive to my operations and to my revenue flow, being aware of that. Avoid staff reduction messaging. So instead, focusing on shifting responsibilities or reallocating tasks to address workflow gaps. I would say, especially if you're talking to revenue cycle manager, billing manager, those who are directly involved with these processes, unless they are talking staff reduction and they've brought it up, I would not bring it up immediately, because that could really be a sensitive issue for them. And if you're just saying that the biggest ROI or the biggest benefit with this is going to help you reduce FTEs, that may scare them a little bit, because they're like, I'm already short-staffed. I don't need to reduce FTEs. And then just be compliance conscious. So claims of full autonomy may raise compliance concerns. So be prepared to explain how your solution ensures regulatory adherence and mitigates liability. So especially when we say that autonomy word, just be prepared to answer those questions or even already speak to them in your demo. Okay, so let's talk about preparation. So what we're going to do is we're just going to go through the steps that typically take place during these demos or these sales calls. I'll run through this quickly because I know we're already at time, but this is really important information. And I'm going to talk about it from both sides as we go through each step, from the revenue cycle leader's perspective and the innovation or the sales team's perspective. So first of all, with preparation, revenue cycle leaders understand your organization's workflows before engaging in a product conversation. Determine the problem you hope to solve with this product and include the end use in the demos, right? Or the end user in the demos. Very really important that the end user be able to see the demo of the product so that they can say yay or nay whether this is going to help or not. But go into that conversation knowing what is the problem that I'm wanting to solve, so it's very clear. Otherwise, what sometimes can happen is the conversation can go in a different direction. And the person who's presenting to you, the sales leader or the sales team, they have a script. They're going off of what they're thinking your problems are or need to do discovery. And so it just might get sidetracked and they might talk about something that doesn't even pertain to you. So to make sure that conversation pertains to you, just know what your problem is that you're wanting to solve and how it works within the workflows of your organization. And then for sales teams, just be familiar with handling common objections. Research the customer to predetermine potential needs that they may have. During the discovery process, so this is the initial phase where the salesperson gathers information about the prospect's needs, their challenges, and their goals so they can tailor the conversation effectively. For RCM leaders, set expectations for a structured discussion. Define your key challenges and success criteria. And then for the innovators, for the sales team, ask discovery questions to identify their true pain points and priorities. Establish those buyer roles, right? So who are you talking to? A decision maker, a champion, a gatekeeper? Don't just start with a generic product pitch, right? First, confirm the prospect's top challenges before positioning your solution. Okay, so then we have the step in this process is called the problem statement. So this is just a clear articulation of the main issue or pain point that the prospect is facing, which the product or the service aims to solve. So during this process, as an RCM leader, challenge the sales team to prove they understand your specific challenges. Ask for real world examples of organizations with similar payer mix, similar specialty, or workflow constraints, and ask for the source of the data. So they're telling you, we have this product solves for this solution. You just want to make sure that they truly do understand what your challenges are. Does your product really solve for my challenges? And ask for those examples. For the sales team, do not assume pain points. Validate them. You may go into the conversation with some assumptions just based on the research that you've done and some standardization, but validate them if you do come with some of those. And provide sourced data and case studies that demonstrate the financial impact of your product on the revenue cycle or for those particular challenges. Okay, so then we have the solution and the product. So this is the offering that's being presented as the answer to the prospect's problem, which you would be the prospect as the RCM leader, including an overview of what it is and how it works. So for an RCM leader, ask if an RCM expert was involved in product development. Determine the workflow, showing how the solution fits into your processes. Ensure that the automation, the AI, or the analytics claims, whatever claims that they're making, are clearly explained and not just marketing buzzwords. Check it out, verify, right? We want to trust, but verify, right? And ask more in-depth questions about it. And then for the sales team side, be explicit about where automation improves workflows. Instead of just listing features, actually show before and after workflow comparison, or where human oversight is still required, or how it integrates with their existing system. So don't just throw out statistics. We've all heard that, or phrases. Reduces your denials percentage to 2%, increases your revenue flow. Don't just say it, show it. Okay, so for your ideal customer profile, so this is a detailed description of the type of customer who would most benefit from the product, including the industry, the size, the challenges, and the buying behaviors. So as an RCM leader, assess whether your organization fits their ideal customer profile, or if maybe you're an edge case, right? So you want to ask, what size practices or hospitals benefit most? Do you work with my specialty or my payer mix? What issues arise when your product is applied in a setting like mine? So, because there's no point in continuing the conversation if you aren't even their customer. And honestly, they're going to be doing the same on their end too. But if they don't really, what we call disqualify it enough time, you don't want to waste your time. You don't want to waste their time. So you can be asking these questions as well. For the sales team, you want to clearly define your ICP, right? Be honest if the prospect is just not your ideal fit. Don't force a sale that won't succeed. Set proper expectations about where your solution thrives versus where it struggles. Nothing wrong with being honest. And there's a whole sales approach to that, which I am not a sales expert. That you would need to get from a sales expert on exactly how to approach that. Okay, so we have value proposition and key benefits. So this is a concise explanation of the unique value the product delivers and the most important benefits it offers to the customer. So as a RCM leader, ask for real numbers. How does it actually reduce denial? How does it increase revenue collection, save time on manual processing? So these are things they're going to say to you are value propositions or key benefits, but ask for them to give you real numbers, example case studies. As for the sales team, provide that. Do not rely on generic, again, increase revenue are those types of claims, right? Instead, present actual case study metrics, expected financial impact for organizations of similar size and specialty, and breakdown of efficiency gains. So reduced backlog, coder productivity improvements. The more specific you can be, the much better than with generic claims. With our product feature, so this is specific capabilities or functionalities of the product that support its value proposition and address the customer's needs. So for an RCM leader, request a live demonstration. And in that demo, ask, what is the value to me, right? And what gaps remain that require human oversight? Be an advocate for yourself, right? For your sales team, be honest about feature limitations. If something isn't available yet, say so. But provide a roadmap if it's relevant. Let them know 6 months from now, this is going to be added. But do not overpromise and underdeliver. Show how the solution directly solves operational challenges and highlight features that bring them value. Use some customer success stories to highlight real world adoption. But you want to make sure that it speaks specifically to them, to their situation, their scenario, as close as you can get, because we do have so much that's specific and special to each of our operations. Then we have our differentiators. So this is what sets the product or company apart from competitors. So unique aspects that make it the best choice. So as an RCM leader, ask, why do organizations pick you over others? What solutions might be consolidated because of your product, right? What do your customers love about your product? And current customers, right? To get those differentiators. So not just because the salesperson is saying it's a differentiator, ask for customer feedback on that. And then for sales, clearly differentiate your product. I cannot stress enough how important differentiators are. Find out what it is that makes you different in the industry and clearly differentiate your product. Be transparent about gaps. If a competitor has a feature you don't, explain why and what your roadmap looks like. If your solution is more expensive, justify the value. Have that conversation about cost versus value. And so important. And then speaking of cost, we have the pricing conversation, which is the cost structure of the product or service, and including any tiers, discounts, or payment options. So as an RCM leader, you want to clarify, are there hidden costs? Per user fees, API access charges, implementation fees, all of that. Does pricing scale with usage, transactions, or users? And then for the sales team side, break down pricing clearly. Don't bury fees. We don't want backs, right? We don't want them signing up and clawbacks and then canceling their contract, right? So if pricing is usage-based, explain how to estimate the costs, provide an ROI model that justifies the investment. And then we have references and objections. So references are testimonials or case studies from satisfied customers that build credibility. Objections are those common concerns or barriers that are raised by prospects with prepared responses to address them. So for RCM leaders, ask for references from similar customers. Ask for an NPS score, which what that means is, would the customers recommend you? That's how they get that NPS score. Customer feedback, what they like, what they don't like. What do current customers say about long-term success? Ask the seller to prove the source of any data or statistics. And then for the sales team, use real customer testimonials, not marketing slides. If you lack the case studies, use pilot data or client testimonial, and be prepared with responses to common objections. And then we move to implementation, right? Sometimes we forget to ask about implementation while we're in the sales process because we're so focused on product, does it need my solution or not? But it is so important to talk about the implementation of the product. What's going to happen after I sign on the dotted line, right? So ask them, does your team provide full implementation support or do you just hand off the product? Are you just going to give me videos to watch? What's the expected timeline? What training is included? So important. And then for the sales team, set those realistic expectations about implementation. Be upfront about any IT or security integration requirements. Provide a post-go live support plan so they know how you're going to be able to assist beyond that onboarding. And customer support, this is another one we forget to ask about, right? But it's so important, right? It goes without saying that after the implementation is completed, kind of the dust settles, there's still going to be support that's needed, right? Things are going to happen, they're going to break, they're not going to go as planned. So you need to ask them, how does your team handle ongoing support? How does your team handle product enhancement suggestions? Do you accept requests for customization? And for the sales team, showcase long-term customer retention, not just initial wins. Have a referenceable client available for potential prospects to talk to. And if there's no case studies that exist, provide data again from pilot results or ROI models. Okay, so finally, next steps, right? So you've completed your demo, you've completed your conversation. So for leaders, schedule a follow-up with the decision makers of your organization. Ensure you have all necessary documentation for internal review. And don't make any promises. Don't tell the vendor that, yeah, I'll go to the next step. We can do a proof of concept. If you're not really at the place where you're ready to do a proof of concept, be realistic. Tell them what you're going to do. Go back, talk to someone, whatever it is. But make sure that you have what you need from the vendor before you go back to those decision makers or to your group of leaders to have that conversation. And then for the sales team, give a clear next step. Are we doing a trial? Are we doing a demo? Are we doing a pricing review? What is happening next? Provide materials the RCM leader can use to advocate internally. So this is really big. So if you can help them with the ROI presentation, value proposition, whatever it is that they need to win, which is going to help you win, help them with providing those materials. And also don't make any promises that can't be kept. All right. We're finally at the end. I hope that you did find that to be informative. I hope that you learned at least one thing from that. So glad to be with you here today.